Imagine the worst headache you've ever had. Now multiply that intensity by 10. That's what a subarachnoid hemorrhage feels like. Picture a pounding, relentless pain unlike anything you've experienced before. That's because a subarachnoid hemorrhage isn't your everyday headache. It's a full-blown medical emergency, a ticking time bomb inside your head. This condition, as terrifying as it sounds, is a type of stroke that occurs when there's bleeding in the space surrounding your brain. It's not a mere migraine that you can soothe with a cup of tea and a good night's sleep. It's a relentless, pulsating agony that demands immediate medical attention. You see, when such a hemorrhage strikes, it's like a lightning bolt to your brain. It's as if your head is trapped in a vice, the pressure constantly mounting, the pain crescendoing to unbearable levels. Now you must be wondering, what exactly is a subarachnoid hemorrhage? A subarachnoid hemorrhage isn't just a fancy medical term, it's a life-threatening condition. In layman's terms, a subarachnoid hemorrhage is bleeding that occurs in the space between your brain and the surrounding membrane, known as the subarachnoid space. It's comparable to a garden hose springing a leak, except in this case the hose is a blood vessel in your brain, and the water is blood seeping out, causing a buildup of pressure. This pressure buildup can lead to a variety of symptoms, the most common and severe being an intense headache. This isn't your run-of-the-mill tension headache. We're talking about a sudden, excruciating pain that many have described as the worst headache of their life. Other symptoms can include nausea and vomiting, often accompanied by a stiff neck or blurred vision. In more severe cases, a subarachnoid hemorrhage can cause seizures, or even result in a person losing consciousness. The human brain is a delicate and complex organ, and the sudden increase in pressure caused by a subarachnoid hemorrhage can lead to significant damage. This is why it's crucial to recognize these symptoms and seek immediate medical attention. But as with many health conditions, prevention is better than cure. So what can we do to avoid this potentially life-threatening situation? Well, the first step is understanding what factors can increase our risk. Knowing the risks is half the battle won. So what factors increase the risk of a subarachnoid hemorrhage? Certain factors can put you at a higher risk for a subarachnoid hemorrhage. Now let's delve into what these are. High blood pressure tops the list. It's like a ticking time bomb, silently causing damage that can lead to this severe form of stroke. Smoking is another major culprit. It's not just bad for your lungs, but it wreaks havoc on your blood vessels too, including those in your brain. A family history of subarachnoid hemorrhage can also increase your risk. The condition can sometimes run in families, likely due to inherited traits that weaken blood vessel walls. An example is Barry's aneurysm seen in people with autosomal dominant polycystic kidney disease. Additionally, excessive alcohol consumption, illicit drug use, particularly cocaine, having certain blood disorders and taking anticoagulants like warfarin can also put you in a high-risk category. And let's not forget about age. The risk tends to increase as you get older, especially after the age of 40. But remember, a subarachnoid hemorrhage is a medical emergency that requires expert care. A brain surgeon in a well-equipped hospital is your best bet when dealing with a subarachnoid hemorrhage. It's not a statement to take lightly. This condition is serious, and it requires specialized medical attention. The delicate nature of our brains and the complexity of this condition necessitate the steady hands and expert knowledge of a neurosurgeon. They have the skills to navigate the intricate landscape of our minds, to alleviate the pressure and repair the damage caused by this form of hemorrhage. But what's better than treatment? Prevention. Let's talk about ways to reduce the risk of a subarachnoid hemorrhage. One of the most important factors is keeping your blood pressure under control. High blood pressure can damage your blood vessels, increasing the risk of a rupture. Regular checkups and a balanced diet can help maintain healthy blood pressure levels. Another crucial step towards prevention is quitting smoking. Smoking weakens the blood vessels, making them more susceptible to ruptures. It's a hard habit to break, no doubt, but the benefits of quitting far outweigh the challenges. And let's not forget the importance of regular exercise. A strong heart promotes healthy blood circulation, reducing the strain on your blood vessels. So, lace up your shoes and get that heart pumping. Knowledge is power, and now that you're armed with this information, you can help protect yourself and your loved ones. Now that we have passed such great information, support us by subscribing and sharing for more informative health-related YouTube videos. Thank you.